Hello, this is Kevin Adams, and this is my comprehensive physical assessment for Nursing 507. I've got all the supplies that I need here, and it's either single use or it's been sanitized for this one patient, and I hope you enjoy it. Hello, my name is Kevin. I'm going to be your nurse for the next hour or so, and what I want to do is an overall head-to-toe assessment, just to kind of get a general idea of your health. What do you want me to call you?
I'm Blake.
Blake? All right, Blake. And do you consent to this exam?
Yes, I do.
All right, well, let me explain a little bit of what we're going to do. So what we're going to do first is, like I said, a head-to-toe exam, and where you're going to be sitting just like you are, and at some point I'm going to get you to lie down, and then at the end of the exam you're going to be standing up next to me here. So what we're doing is we're gathering information, like I said, about your general health. So the things I'm going to be doing basically is look, listen, and feel. I'm going to be looking and inspecting your skin and your face and your legs. Also, I'm going to listen. I'll be listening with either my ears or with a stethoscope at your organs and your body parts. And feel. I'm going to be palpating and touching your skin, looking for warmth or cold, palpating your organs and your back and such, gathering information about your health. Is that good?
That's perfect. Good.
All right, good. All right. So the first thing I'm doing is just looking at your overall general health. So your general health looks good. Your hygiene apparently is important to you. Your skin is clean and color is good. Color is pink. And behavior-wise, your behavior is normal. Your questions are appropriate. Your answers are appropriate. And I don't see any signs of distress. One thing I do want you to do, though, I want you to tell me if there's anything that we're doing as I'm doing these inspection on you or this assessment on you. If you have any pain or tenderness, let me know.
Okay.
All right, good, thanks. Now, I noticed when I walked from the scale into the room here that your gait was good, your balance was good, your posture is also as good as well, and that your motor movements seem to be appropriate. Now, what we did is we got you on the scale and we got your weight at 113.5, and also your height is 5.6. So we put that in the calculator from the NIH and comes out with a body mass index of 18.3. Now, 18.5 is considered, or below 18.5 is considered underweight. But from what you tell me, you've always been underweight. So it's not anything from a disease process or you weren't sickly as a kid. That is your normal, to be a little bit underweight. Good. The first thing I want to do is get some vital signs on you. So I'm going to get your temperature, count your pulse, count your respirations. I'm also going to put something on your finger called a pulse oximeter, and it checks the oxygen level in your blood. So that's what I'm going to do first. Put this right on your finger, and it's going to stay like that counting. Also want to get your temperature. I want you to put this under your tongue. All right, thank you. 92. And I'm going to get you, all right, so your pulse is 84. Your oxygen level is 100, which is perfect. That's the highest number you can get. And the next thing I want to do is your blood pressure. So put this on this left arm. I'm going to tighten it up. Just like that. And listen to your blood pressure. All right, it's going to be a little snug just for a minute. Good. All right, 110/60, that's fine, that's perfect. All right, this can go. Now, one thing I want you to do is to let me know if there's any pain or any discomfort, anything sensitive during the time that you're here with me. We're doing this assessment. Let me know. Do you have any pain right now?
No.
No, good. All right. And so now I'm looking at your skin, just doing an overall inspection of your skin. Skin is nice and dry. I felt it with your arms early when I was doing your blood pressure. And I want to check your skin turgor. If you give me this hand. And then what I'm going to do is I'm going to pinch the skin just a little bit like that, and it should be returned rather briskly. And when it returns briskly that way, it means you have good skin turgor, so that is good. If you didn't, if it would be a little, stay up a little bit longer, it might be that you're dehydrated or something like that. And older people, unfortunately, their skin doesn't return as quickly as the younger. All right, so I'm looking now at your hair. Hair is clean. I'm looking for, what I'm doing is just checking to see if you have any points of alopecia, which is some kind of bald spots, some spots where the hair is not growing. Also looking for any infestation. I don't see any of that. I'm looking at your overall appearance. I'm looking for symmetry in the shape of your head and your ears and your face. And I'm going to feel up here on your scalp, any place that it's tender, anything like that? Nope. All right, good. All right. Let me take this off. All right, let me see one of your hands again. I want to check your nails. So your nails are nice and smooth and pink. And what I'm doing, I'm pressing here and looking for capillary refill. When I press it, it kind of turns white, and when I release it, it briskly turns red again. So it shows you have good circulation. So that's good. And the next thing I want to do is I want to feel the muscles of your face that you used with chewing. And what I want you to do is kind of clench your teeth, and I'm going to like this. All right, those are your masseter muscles used for chewing, and these are the temporals. You feel that? Mm-hmm. Okay, good. All right, so that's they're equal is what I'm looking for, and strong. And so, and also what I'm looking at, the features of your face, I'm looking for symmetry. If there's any kind of drooping or any swelling could be your eyes, could be allergies, could be infection. If there's any kind of droopiness, could be a palsy of some sort, or maybe someone who's had a stroke in the past. And then next I'm going to look at your nose. So what I want you to do, get this light.
I know.
All right, and the next thing I want to do, I want to look at your nose. So the first thing I'm doing on the outside of the nose, looking for symmetry. Some people who've had like a broken nose or whatever in the past may lean to one side. Have you ever had any injuries to your face that you know of? Okay, just put your head back a little. I want to look inside. All right. All right, both sides are equal. They're open. The mucosa inside is pink and moist. That's good. All right, now we're going to look. All right. Oh. Okay, and then now I'm going to check your sinuses. What I'm going to do is I'm going to push on your sinuses, the frontals and the maxillary, and you tell me if there's any tenderness. Okay. Right up here. Is that all right?
Yeah, that's fine.
Okay, and then these on either side of your nose here.
Yeah, those are
good.
Too.
No pain?
No pain.
Okay, good. All right, excellent. Now, all right. Now the next thing I would do, I'm going to test some of the feeling in your face, some of the sensations in your face. So I have this little Q-tip. I want you to close your eyes, and you can tell me if I'm using the dull end or the sharp end. This on your forehead.
Dull.
All right, here. This side, left side.
Dull.
All right, we're going to move to your cheeks.
Sharp.
All right, and the left side.
Sharp.
All right, and then the jawline.
Dull.
And this side.
Dull.
All right, good. Excellent. All right, no problems there. All right, and all right. So next I'm going to be looking at your ears. So just from the front here, I'm looking at symmetry. I'm looking at the size of your ears. I'm looking at the skin. I don't see any kind of exudate or any kind of scars or anything like that. Some people have had piercings in their ears, and people get what's called keloid, which is a kind of an overgrowth of tissue in the scar of the pierced ear, but you don't have any of those. And now I'm going to look with the light. All right. So the next thing I want to do is I want to look into your ears with the otoscope. And what I'm looking for, I want to make sure there's no redness or irritation or any foreign bodies in there. So what I'm going to take this, turn this light on, and I'm going to pull your ear kind of up and back and take a look inside. You let me know if this is tender or irritated. All right, that looks good. Now turn your head the other way for me. We're going to look in the left ear. Again, up and back. All right, looking for foreign bodies. Okay, there's nice and pink. There's no redness, anything like that. And no tenderness in there?
No.
Okay, good. All right, and the next thing we're going to do is 3 simple hearing tests. Now, this doesn't take the place of going to an ear doctor if you have any issues at all or any doubts at all. But what we're going to do is we're going to use this tuning fork, and we're going to test your right ear first, and then we'll go to your left ear. What I'm going to do is I'm going to hit it on my hand here, and I'm going to put it up near your ear, and I want you to tell me if this part is louder, or when I put it back here on your mastoid bone, if that part's louder. All right, so let's do that. Listen to that for a second. And now I'll put it against your bone. Which is louder?
The first.
The first. Okay, so that's air conduction is louder than the bone conduction. And now we're going to go to your left ear. So same thing. I want you to tell me which is louder, this or here, when I put it against your bone.
The first.
Okay, so that's air conduction. Sounds like your air conduction is better than your bone conduction, which is a good sign. That's a positive test. That's a positive Rainey test. The other test I'm going to do for you is I'm going to put this, hit it, and I'll put it directly on your head. I want you to tell me, is one ear louder or less than the other, or are they both about equal?
They're both about equal.
Okay, excellent. All right, and the last test I'm going to do is a whisper test. So just what I'm telling you. I want you to cover this ear with your hand, and I'm going to whisper something on this side. You tell me what I said. 1, 2, 3. What did I say?
1, 2, 3.
All right, cover your left ear. What did I say?
A, B, C.
Okay, excellent. All right. If there was any doubt at all or any one less than the other, then I would definitely recommend seeing an ear doctor, more professional. And the next thing I want to do is examine your eyes. So the first thing I'm doing, I'm looking for symmetry. I'm looking for alignment when you're looking at me to make sure they're aligned. I'm also looking at your eyebrows, again, for symmetry, looking at the hair distribution, hair quality. I don't see any problems with that. And next, I'm looking at your eyelashes and your eyelids, looking for redness like a sty, looking for any kind of exudate or drainage like bacteria. It could be a bacterial infection. If you have any droopiness or any kind of what's called ptosis on one side or the other, could be a sign of myasthenia gravis or a problem with your third cranial nerve. I don't see any of that, so that looks good. And then looking at your orbit, I'm looking up here. This is where your lacrimal glands are. I don't see any swelling, which could be a sign of obstruction. Now that we've done a general inspection of your eyes, we're going to check your extraocular movement using the 6 fields of gaze. So I want you to keep your head straight, and I want you to follow my finger. All right, very good. The next thing we're going to do is check your peripheral vision. What I want you to do is cover your right eye first, and I want you to tell me how many fingers, look straight at me, how many fingers am I holding up?
2. 1. 1. 2.
All right, switch eyes. All right, how many fingers?
2. 2. 1. 2.
All right, very good. All right, as you can see, I've dimmed the lights because what I want to do next, I want to check your pupils, check their response to light. So what I'm going to do is I'm going to shine a little light in your eyes and check and see how quickly your pupils contract and how they respond. All right, look straight at me. Ah, very good. All right, and the left. All right, excellent. So these responded well. They're nice and brisk. So your pupils are equal and reactive to light. Get the lights back on. All right, now that we have the lights back on, I want to palpate your periorbital area. So first I'm going to look at your sclera, make sure it's nice and white. We're going to look at your conjunctiva, make sure it's nice and pink. if there was any redness or drainage or anything like that, or swelling, I want you to let me know how it feels, if there's any tenderness at all. It looks fine, which is good. Close your eyes for me, and I'm going to press around all the bony part around your eyes, around the lacrimal apparatus, which creates your tears, and down at the bottom of your eyes here, and keep your eyes closed. Now I'm going to press right here, your lacrimal ducts. That's where the tears drain into your nose. All right, that looks good. Any tenderness, any pain?
No.
Good. All right. And one last thing, are you wearing contacts now?
Yes.
Okay, so we're not going to do this last part of your test. But what I would be doing is I would press on the globes of your eyes and release, and we're checking for pain and pressure that might mean a sign of glaucoma. All right, thanks. Next, we're going to move down to your neck. So what I'm looking for is symmetry. I'm looking for your trachea and your thyroid, make sure that it's symmetrical and it's midline. What I want you to do for me now is to swallow. And what I'm going to do is watch for your cricoid and thyroid to rise and make sure it stays symmetrical. The next thing I'm going to do is going to look at your lymph nodes of your face and your neck. So you stay just like you are. I'm going to feel right here, which is preauricle, looking for any lumps and bumps. Let me know if there's any tenderness there. We're going to go post-auricle, behind the ear. That feels fine. We're going to go more occipital. You can keep your head straight just like that. All right, and then submandibular. No lumps, no bumps. Any tenderness?
No.
This is submental. And now we're going to go down to cervical. I'm going to follow your neck down on both sides, feeling for any lumps. Those are your lymph nodes I'm feeling for. And subclavian. Any tenderness there?
No.
All right, very good. That looks good. To your mouth and throat. So what I'm doing now is looking at your lips, making sure they're nice and pink. If there was, and they're not cracked and dry, which is good because that could be a sign of some kind of vitamin deficiency. Color-wise, little blue might mean your oxygen level is a little low. Bright red could mean you have a problem like COPD, which I don't think that's an issue for you at all, which is good. All right, and so now we're going to do is going to look inside your mouth. I'm going to get my tongue depressor and a pen light. I've got a new one here. All right, open your mouth for me. All right, all right. All right, now what I'm doing is at first I'm looking at your oral mucosa, nice and pink and moist, looking for any teeth cavities, anything like that. Raise your tongue up for me. All right, no lesions, nice and pink. It's not a surprise to see blood vessels under there. Do you have any loose teeth that you know of?
No.
Okay, I don't see any at all, which is good. All right, put your tongue down, stick your tongue out for me, and move it all around. Okay, that's a good sign because that checks out your cranial nerve 12, which seems to be good. Open your mouth again for me and say, ah. All right, I'm watching your self palate rise. Your uvula is midline, and I don't see any lesions or anything like that. Very good, thank you. All right, now we're going to move down to your chest. So what I want you to do now is I want you to push up, raise your shoulders against my resistance. Very good. All right. Now I'm looking at your breathing, looking at your chest rising and falling. Doesn't seem like it's labored at all. Doesn't look like you have any difficulty right now with your breathing. Are you feeling all right?
Yep.
Good. All right. And so I don't see any unusual lesions or any abnormal pulsations, anything like that. Let me get you to turn that way, and I'm going to watch as your chest rises and falls with your breathing. I'm going to put my hands here. Take a deep breath in. Good. And out. Very good. One more time. In and out. Very good. All right. All right. And the next thing I'm going to do, you're going to feel my hands on your back. What I'm feeling for is fremitus, which is some coarse vibrations that could mean consolidation or pneumonia, something like that. I want you to say 99, 99,
99. 99. 99. 99.
and one more time.
99.
Excellent. All right. And the last thing I would do is check your breath sounds. Warm up this stethoscope a little bit. You're going to feel my stethoscope on your back, and I want you to take deep breaths in and out through your mouth. Open your mouth, take some deep breaths, and out. Good. Again, in and out. Great. All right. Again, in and out. Excellent. In and out. Good. Again, in and out. Okay, again. All right, out. All right, I started at the apex. I did the middle lobes. Now I'm going to look at the lower lobes. In and out. In and out. A couple more times. So one more and out. And one more and out. Okay, excellent. So I was listening for, there are some normal breath sounds that we hear on everyone. And they're normal as long as they're heard in the correct spaces. There's vesicular, bronchial, and vesicular. So bronchial breath sounds are heard over the larger airways like the bronchus. Bronchovesicular are heard all in the outer portions of your lungs, and I did hear those just fine. Everything was in the right place, which is good. All right, thank you. And now what I want to look for is the shape of your chest, the anterior posterior diameter of your chest. If it was larger and wider, it could be a sign of barrel chest, which is a sign of COPD, some kind of emphysema, breathing problems like that. You don't have any of that, so that's good. All right. All right, now I'm going to listen to your breath sounds again, but from the front this time. So again, I want you to take some deep breaths for me in and out. All right, deep breath in and out. Up and out. Good. Listen to the apex, in and out. Good. All right, we're going to do the upper lobes, in and out. Again, in and out. And move down a little to the middle lobe, in and out. Good. Again, in and out. Now we're going to go to the base of your lungs, right, in and out. And one more, in and out. Okay, good. Thank you. Now, before I listen to your heart sounds, I want to listen to your carotid arteries. So what I want to get you to do is I'm going to tell you when to hold your breath so I can hear your carotids. Hold your breath. Good. And this side, hold your breath. Good. All right. And what I'm listening for is any kind of like noise, like if there's any kind of blockage up there, and I don't hear anything like that. So that's good. So next we're going to listen to your heart sounds. All right, to listen to your heart sounds, I'm going to use the bell first, and I'm going to use to listen to your heart sounds, I'm going to use the diaphragm first, and then I'm going to switch to the bell. And there's 5 spots I'm going to listen to, and I'm listening to each of your valves. So all you want you to do is just breathe normally. Don't breathe deep. So I'm feeling for the sternal notch right in the center here. And if I move to the right, that dip right there is the second intercostal space on the right side. Then I go to the second intercostal space to the left side. And that's going to be your aortic valve, pulmonic valve, a second area that I can listen to your pulmonic valve. And we're going to go down to the tricuspid and the mitral valve. So we're going to start up here, just breathe normally. Again, here's your second intercostal space. And I'm listening for that lub-dub sound, which is normal. Just lub-dub, lub-dub. Excellent. Moving down to the third intercostal space. All right, great. Now we're going to move down to the tricuspid area. And finally, the mitral valve. All right, now I'm going to turn this around. Keep breathing normally. To the bell side. Again, second intercostal space on the right for the aortic valve. Second intercostal space on the left side for pulmonic valve. Third intercostal space gives us another sound of the pulmonic valve. Fourth intercostal space, I can hear the tricuspid and down to the mitral valve. All right, very good. So what I'm doing now, listen for the lub-dub sound, S1, S2, and that means it sounds like all your valves are opening and closing correctly, which is great. All right, so while you're sitting here, I want to start feeling your pulses on your upper body. So we're going to start with the carotids, which supplies the blood to your brain, right inside to this left side. You feel my fingers thumping? All right. And then your right side. That's a right carotid. All right. Now I'm going to go down to your wrists. I want to feel your radial pulses and your brachial pulses. All right. I'm going to switch arms. This is your radial pulse. And here, and right in the crease is your brachial pulse. All right. Very good. Very good. All right. And now we're going to stop for a second. I want to get you to lie down. All right. So now we're going to continue with your pulses. I did your upper body and your arms. So we're going to go down to the lower body. So your femoral pulses are right on the inside aspect of your, right in your groin area. The right, and then the left. And then I'm going to go down to the popliteal, which is behind your knee. Just keep it relaxed. Very good. And the left. Very good. I can feel nice and bounding. I'm going to go down to your feet, and you have two separate pulses I'm going to feel. First, the top of your foot is the dorsalis pedis. And it feels great. That's like a 1+. And behind your ankle here, feeling both of these. All right, very good. That's like a 2+. That feels good. All right. Now, also while I'm here, your feet are nice and warm. I don't see any problems with coloration. Everything like that looks good. All right, very good. Thanks. So if you had any kind of concern of breast cancer in your family or a history of breast cancer, then we would do a breast exam. Even on males, it's not as common, but it still can happen with males in breast cancer. So we actually palpate all 4 quadrants of each breast and make sure that there's no lumps or bumps or anything else there. What I do want to check though is your lymph nodes under your arm. So what I'm going to do is I'm going to move your arm out a little bit like this, and I'm going to be feeling for your, in the cover, like 4 different areas of your axilla, your underarm. I'm going to feel right behind, right in the anterior axilla area. No bumps or lumps there. The mid-axillary line, no bumps or anything like there. And then back in the post axilla area. All right, don't feel anything there. Now I'm going to use my fingertips up into the apex of your axilla. Again, feeling for any kind of bumps. Any tenderness in there?
No.
No? Good. Okay, that wouldn't be a concern right now then. And what we'll do is we'll do this to both sides equally. Anything that we usually test, what we do is we look for symmetry. So again, I would go to the other side and check the other side as well. All right. All right, now we're gonna take a look at your belly, at your abdomen. So I'm gonna stand here at the foot of the bed, and I'm looking at your belly here, right at your midline, and I'm looking to make sure your umbilicus is right even in midline with your sternum. I'm also looking for any asymmetry in your abdomen as well as any distension, and I don't see that, so that's good. And the next thing I'm going to do is I want to listen for bowel sounds. And what I'm listening for is peristalsis, which is the action of your intestines digesting your food, and it's the slow movement of your intestines. So I'm going to warm this up a little bit, and I'm going to listen to all 4 quadrants. Now, ideally, we listen to all 4 quadrants for about 2 minutes. So I'll start here up in the, I'll put the stethoscope down gently on your belly. Listen for about 2 minutes. And vowel sounds kind of sound like an aquarium, little bubbly noises. All right, I can hear those. It doesn't seem to be hyperactive. We're listening for vowel sounds anywhere from 5 to, you should have 5 to 35 every minute. Very good. I'm going to move to the next quadrant in your left upper quadrant. Again, listening for vowel sounds. If they're too slow, like hypoactive vowel sounds, it may be a sign of ileus or peritonitis, but yours seem to be normal. All right, move down to your left lower quadrant. Again, we would be listening for about 2 minutes, all the way to 5 minutes, depending if you need that. And then your right lower quadrant, again listening for vowel sounds, the peristalsis. All right, very good. It does. It sounds like an aquarium. All right, now I'm going to be listening to some vascular sounds. So now I'll be able to hear right up in the center. I could actually hear, I'm listening for any murmurs of your aorta. All right, nothing unusual. Now we're going to listen for murmurs or bruit, not murmur, but bruit. It sounds like a murmur of your heart. We're going to go to the left kidney. So I'm listening for any bruits, which could mean some kind of obstruction or partial obstruction of your renal arteries. And I don't hear that. Your right renal on this side. All right, I don't hear any kind of bruit. Now we're going to move down to your iliac arteries. On either side of your umbilicus, I'm listening for any bruit to the arteries that are going down to your legs. And this is your left iliac and your right iliac. All right, good. And I don't hear any bruit at all, which is good. All right, very good. All right, so we've done the look and the listen on your abdomen. So we did the auscultation and the inspection. Now we're going to do some percussion. And so what I'm going to do is I'm going to do all 4 quadrants, and over organs, it should be a little duller over organs. Over other parts of your abdomen, like the center, there are no organs there, so it should not be as dull. You hear the sound is changing. That's where probably where your liver is. All right. The next thing we're going to do is we're going to do a little also percussion on looking at your spleen between the 6th intercostal space and the 6th rib and the 10th rib. And we're going to do some percussion. Again, a dull sound because it's over an organ. All right. Now we're going to look for your liver. We're going to try to do some percussion for your liver. And so we'll start at the mid-clavicular line and work our way down. It sounds like a little bit change there. I'm going to go all the way down to the area about your umbilicus. Okay, I can hear the difference in sound. So what we're going to kind of do here, now that this side of your liver should measure somewhere between 6 and 12 centimeters. The other part we're going to look at is the right at your midline, right under your xiphoid. We're going to start there. Trying to hear for that dullness. And when it stops, and it should be somewhere between 4 and 6 centimeters. All right. And so when we measured, and it should be between 4 and 6 centimeters, and actually we started about there and heard the dullness, and right to about there, and that right is about 9 centimeters. So that looks like it's in your normal range, which is good. All right. Now I'm also going to start palpating here, right in the center. I don't see any pulsation, which is good. I'm feeling to see if there's any pulsation over your aorta, make sure there's no aortic aneurysm there. All right. Now I'm going to do a little light palpation in every quadrant. You tell me if there's any tenderness there. All right, good. All right, very good. And this right upper quadrant?
No.
No? All right, very good. All right, thanks. So we did some light palpation in all 4 quadrants, but there are some problems that are better diagnosed with a deeper palpation. So I'm going to feel all 4 quadrants again. I want you to tell me if you feel any pain or tenderness. We're going to go a little deeper with our palpation. Things like duodenal ulcers, gastric ulcers may need a little more pressure to get those diagnosed. Also, I'm going to reach down into or reach down and palpate on your right lower quadrant. I'm going to press down, but then I'm going to release. Any pain there?
No.
One more time, we're going to press down and release.
Okay.
Okay, good. Because pain with that motion there could be a sign of appendicitis. All right. Now to check your musculoskeletal system, we're going to be checking muscles, your bones, and your joints kind of all at the same time. And I'm going to focus on your spine, your upper extremities, and your lower extremities. We're going to do some inspection where I'm just going to look and see how everything looks, and also doing some passive, some active range of motion. All right, so let me get you to stand up first and face that wall. So what I'm doing now is I'm just looking at your spine, make sure it's in midline, make sure there's no deviation to the left or to the right, any kind of lateral shape to it could be a sign of scoliosis, something like that. I don't see any of that, which is good. Let me get you to turn back this way again. And I want you to bend over just all the way down, put your arms like this. And what I'm doing is checking for any kind of abnormal curvature of your spine. That's good. Excellent. All right, stand up straight. All right, now face this way with me. Now we're going to start from head to toe. So let me do this real quick. And what we'll do is we're going to start with your head, your neck. So let me get you to turn to your left, turn to your right. All right, now look at me again. Flexing, extension. All right, now I want you to put your head down toward your ear, that way, and back this way to the right ear. Okay, now we're going to do a little resistance, so we're checking out your muscles too. Well, you're going to do the same thing. Try to look to your left, try to look to your right, try to look down, and back up again. Good. And to your left ear to your shoulder. Good. And right ear to your shoulder. Very good. All right, good. That's good. We're going to move to your shoulders. Let me get you to kind of shrug your shoulders against my resistance. Good. All right, let's put your arms straight out. All right, just like that. And I'm going to try to push them up. You try to push them down. Good. And now just the opposite. Excellent. Okay. Hands at your side. Now we're going to do some abduction. Abduction means you're going to put your arms away from your body, all the way up and all the way down. All right, very good. And again, with the resistance, try to lift them again. Very good. Now try to put them back toward you. Excellent. All right, very good. I like that. All right, now we're going to check your internal and external rotation of your shoulders. You let me know if there's any pain there. So I want you to reach behind you like you're scratching your back. This arm and then also this arm. Does that feel all right? Good. Now external rotation, I want you to put your hands behind your back, just like behind your head, and move your arm. Perfect. Good. Just like that. All right. Now put your arms down in front of you, just like this. Now also you're gonna try to externally rotate our shoulders, and now try internally against my resistance. So we're checking your muscles and everything too. While I got you here for your elbows, palms up. I want you to do extending your elbows and now flexing your elbows. All right, very good. Again, try to extend them against my resistance. Push down. Now push up. All right, now we're going to check. Keep your arms up like this. And I want to see how you do with your pronation and supination. That's just pushing them down and back up again. All right, excellent, very good. All right, now I'm going to give you one wrist. You could put this one down. Now, any problems with this wrist, any tenderness, anything like that?
No.
So what I'm checking for is any kind of tenderness, any kind of warmth, like if there was any kind of inflammation, something like that. Arms up like that, just like that. Now you're going to work on your wrist. Flex down, extend up. Excellent. Okay. Now put your palms like this. Now what I want you to do, this is going to be radial deviation Extend your arms out your wrists out this way, and all the deviation this way. Perfect. Good. Any pain, anything like that?
No.
All right. Now your fingers. Flex your fingers and extend your fingers. Great. Now I want you to flex your fingers against my resistance, and now extend your fingers against my resistance. All right. Excellent. Good. No pain, no problems with that.
No.
Good. All right. So when you were standing and I was looking at your spine, I was also noticing that your hips are nice and aligned. Looking at your iliac crest, they're even and horizontal. If you had any kind of scoliosis in your back, you would kind of throw that off and you'd have a little tilt to your hips. I did not see that at all. We're going to do some more testing on your hips, your hip joints. So what I want you to do is I want you to lift each leg off the bed. First this one, the left one, and down. The right one, and down. Now I want you to lift them up like a bicycle, the left one, and down, and the right one, and down. Any pain in your hips, anything like that? Good. Now I'm going to get you to do adduction, is where you move your legs outward and inward. Okay. Now I want to do those same things, but I want you to, with some resistance, try to lift your left leg and your right leg. All right, good. And then I want you to try to move your legs outward away from each other and inward toward each other. Excellent. Very good. All right. So the next thing I need you to do is just to sit up for me on the side over here. You can put your legs off the side. Perfect. Now what I want you to do is I want you to try to lift each knee, each thigh, and I'm going to give you some resistance. Left one, a right one. Okay, that's fine. And this one. All right. Any pain down in your groin or anything like that? Okay, because if you did, you have some kind of hip flexor tendon that may be irritated, but you don't have any of that, so that's good. All right, let's go down to the knees. You can stay sitting. All right, so I want you to extend the left knee and down, right knee and down, and I want now also your ankles. I want you to flex your ankles up, flex your ankles down. I'm going to extend your ankles down. All right, now we're going to do some resistance. I want you to try to lift both of your legs against my resistance, push up. Now pull down. All right, same thing. Try to lift your ankles up and down. All right, very good. Any pain, any problems with your joints that you can tell?
No.
Good. All right, the next part of this test is going to be assessing your 12 cranial nerves. Now, some of those we did already as we're doing other parts of your body, but we're going to repeat those as well. So the first one we're going to do is your olfactory nerve, is your sense of smell. So what I'm going to do is I'm going to put two items in front of you. I want you to hold one, close your eyes, hold one nostril closed and smell that one, and then hold the other nostril and smell that one. And you're going to tell me what it is. All right, so we're going to go with your left nostril and take a deep breath. What is that?
Coffee.
Okay, and the right side?
Coffee.
All right, good. And one more time, keep your eyes closed. All right, cover one nostril and tell me what this is.
Peanut butter.
And the other side.
Peanut butter.
All right, excellent. All right, great. All right. Okay, so that was your sense of smell. The next thing we're going to do is checking your optic nerve. And I pulled up this eye chart of the internet. And so what you're going to do is you're going to hold it at arm's length. And I want you to read the lowest line that you can read comfortably.
PEZOLCFTD.
All right, excellent. All right, 2020. All right, very good. All right, we put that away. All right, the next thing I want to do is check some reflexes. All right, you probably had this done before. So I'm going to we'll start with your arms. I'm going to put my thumb right on your tendon here, and I'm going to hit my own thumb. All right, good. And this side. All right, good. What we're looking for is some real exaggerated jerky movements, and that would tell us that you have some kind of problem, a neurology problem. All right, and then this side, we're going to do another one here called the brachioradialis. I'm going to tap it here, right on the bone. Oh, you saw your thumb? All right, and this side, but it's not exaggerated and jerky. Sorry about that. How's that? All right, good. All right, let's move down to your knees. Keep them relaxed. Keep them just dangling like that. We're going to do the right one first. We do it twice. There you go. Good response. Okay. But not, again, not exaggerated, which is a good sign. That's a normal sign. All right. And then we're going to go down to Achilles, which is the tendon on the back of your foot. I'm going to grab your foot here. I'm going to hold it just like this, and I'm going to tap it on the back. Good. We're looking for abnormally kind of, real exaggerated jerky movement, but you're not having any of that. All right. And one more. All right. That's good. For this last part of the test we're going to do now, it's going to be watching your gait. Now, we did that earlier at the beginning of the exam when I watched you walk from the scale to the table here. But we're going to do this one more time a little differently. Come with me. I want you to stand here. And what you're going to do is you're going to walk like on a tightrope. So you're going to put one foot in the front of the other, kind of a tandem walk, and walk like you're on a tightrope. One foot in front of the other, nice and slow. So what I'm doing is I'm watching your balance, I'm watching your gait, I'm watching your movements, and that looks fine. That looks good. And do you feel about pretty steady?
Yep.
Excellent. Well, I'll tell you what, that is it. You are done.
Thank you
Thank
very
you
much.
for your help. I
I
appreciate it.
Thank you.
Thanks.